Look at this automated line. It is churning out a fraction of the millions of glass vaccine vials India produces every single day. Today, the country commands the low-cost generic drug market and manufactures over 50% of the globe's vaccines. But rewind a century to streets like this one in 1890s Calcutta, and the picture was incredibly fragile. Back then, India relied entirely on foreign empires for something as simple as an antiseptic wipe or a basic fever pill. This dependency created a lethal bottleneck. If a global outbreak disrupted shipping routes, the imported medical supply chain would freeze instantly, leaving hundreds of millions of people completely defenseless. At the time, political rallies and protests for independence were gaining momentum. Yet political sovereignty meant very little if the country still had to rely on its colonial rulers just to survive the next flu season. At the time, British companies imported almost all chemicals and packaged medicines into India, selling them at exorbitant markups. A chemist named Acharya P.C. Ray recognized the trap. Using a meager 700 rupees and a makeshift setup in his own kitchen, he began boiling raw materials to synthesize his own high-grade chemical compounds. That kitchen experiment scaled rapidly, becoming Bengal Chemical. It gave the growing swadeshi movement tangible proof that domestic industrial manufacturing was actually viable. Ray constructed the physical hardware of this new ecosystem. He demonstrated that local scientists could synthesize medicines that rivaled imported goods in quality, keeping capital and resources inside the country. But as we look at the chaotic shelves of an early 20th century pharmacy, the second missing pillar becomes obvious: labor. At the time, dispensing medicine was a risky trade, dominated by untrained compounders guessing at dosages. New factories were useless without a scientific workforce to operate them safely. Professor M.L. Schroff recognized that scaling pharmaceutical production required a highly educated, standardized class of clinical professionals. In the 1930s, Schroff launched a massive academic overhaul. He established the country's first Bachelor of Pharmacy program at Banaras Hindu University and wrote the core framework for the Pharmacy Act to legally enforce clinical standards across the board. Schroff essentially installed the software for the industry. He replaced a disjointed network of tradesmen with a regulated, trained workforce capable of running large-scale medical operations. This brings us to a critical breaking point, captured here in the field hospitals of World War II. The global conflict completely severed the British shipping routes that India still relied upon, instantly starving hospitals of critical supplies. Facing a massive medical shortage, Dr. K.A. Hamied and his company, Cipla, executed an emergency pivot. They began aggressively reverse engineering complex synthetic drugs to bridge the gap and keep local wards functioning. Navigating this crisis cemented a specific operating philosophy for Hamied: the belief that essential, life-saving healthcare must remain accessible to the masses at a steep discount compared to Western pricing. Hamied successfully stress-tested the domestic supply chain. He proved the local industry could rapidly scale up production during a global blackout while maintaining an ethos of extreme affordability. The final piece of the ecosystem required original intellectual property and quality control. For decades, colonial authorities had dismissed centuries of indigenous botanical knowledge as unscientific folklore. Then, scientists like Sir Nath Chopra started applying rigorous modern clinical trials to native flora. Take a look at this plant, Rauvolfia serpentina. Chopra's research validated its medicinal properties, providing the clinical data that led to standardized treatments for high blood pressure. When a subsequent influx of counterfeit imported medicines threatened public safety, Chopra took legal action. He authored the 1940 Drugs and Cosmetics Act, enforcing strict quality control parameters across the entire nation. By marrying original, localized R&D with stringent safety protocols, Chopra gave the Indian medical sector the legal and scientific legitimacy it needed to operate on the world stage. With manufacturing, education, domestic scaling, and strict regulation finally locked into place, the medical ecosystem became fully self-sustaining. Together, these four chemists operated as the architects of a sovereign medical state. They successfully severed the supply chain dependencies that had tied India to the British Empire. We usually measure the construction of a nation by the treaties signed by politicians or the borders defended by soldiers. Yet this deliberate, quiet rebellion in laboratories and halls was equally vital to the country's survival. Which means the next time you pop a pill from a blister pack like this one, you're looking at the direct result of that timeline. Every affordable generic drug available today traces its lineage straight back to those early interventions. India's status as a global pharmaceutical leader today is the intentional, engineered result of scientific work performed in colonial laboratories. It is a legacy of self-reliance forged a century ago through chemistry and clinical data.